Welcome to What's Now. I'm your host, Christine Napier, and this is a show where we find out all about new research, fabulous products, what is trending, things you need to have, seasonal musts, and much more. And this episode focuses primarily on your health and also fabulous series that is back, Black Ink Crew. So let's get started, but first with your health. Unfortunately, way too many Americans will be diagnosed with lung cancer this year. And it's not a one-size-fits-all treatment. Surgery can be very risky. Survival rates, especially with the advanced cancer, can be really just not good. So I spoke recently with Dr. Eric Bernicker all about this. Let's take a look.
Roughly 237,000 Americans will be diagnosed with lung cancer this year, but treatment is not a one-size-fits-all approach. For those whose cancer is discovered early, the risk of it coming back after surgery can still be high. For others in more advanced stages, extending survival can be the greatest challenge. Fortunately, researchers have continued to provide hope for patients across stages of lung cancer. Here with important information on managing a lung cancer diagnosis, the latest research findings, and a recently approved treatment option for some patients is Dr. Eric Bernicker, Director of Thoracic Medical Oncology, Houston Methodist Cancer Center. Thank you so much for being here today.
Thanks for having me.
What is the most common type of lung cancer, and what is the impact of it on Americans?
The most common type of lung cancer is non-small cell lung cancer. Probably about 80% of the cases that we see. It's important to remember that lung cancer really is a huge and remains a huge public health issue. It's the leading cancer killer. So while it's not a contest, lung cancer is killing more people than colon and breast and ovarian cancer, and remains just a huge issue that we need to grapple with in the medical community.
And I also understand that historically lung cancer has been a very challenging disease to treat. Why is that?
So a lot of patients, there are a number of reasons, and a lot of patients will present to their physician when the disease is already spread outside of the chest. And in that situation where it's metastasized, it's really not amenable to being surgically resected, which is what gives people their best odds. And in addition, unlike, say, breast cancer or colon cancer, we really, until recently, have not had adequate screening for this cancer. There is CT screening now, and we really urge people at high risk, so people who are former or current smokers, we really encourage them to be screened. And we really hope that as we detect more early stage lung cancer, we're going to move the needle much more in terms of survival rates.
And if someone is newly diagnosed with small cell lung cancer, what are some of their options?
So if it's early stage disease, has not spread outside the chest, and the patient's a good candidate, then our treatment of choice is surgical resection. If they have a lot of other medical issues that might make surgery risky or dangerous, we'll treat them with radiation. It's important to remember that about 50% of people who get surgically resected will still recur and develop metastatic disease, which is why we're very excited in the field. Recently, there have been a number of developments. The FDA has approved a combination of chemotherapy drugs with an immunotherapy drug called Opdivo, which is the first and only immunochemo regimen given pre-operatively. For the sake of disclosure, I'll mention that Opdivo is made by Bristol Myers Squibb, and I've done research with them in the past. This combination, we think, really has a lot of potential to improve response rates and to really hopefully improve long-term survival rates. I'll also mention that Opdivo is also utilized in advanced stage disease, often with another immunotherapy drug and a chemotherapy-free combination. So we have more and more options for patients with both early and more advanced stage disease. Clearly, there are potential side effects of these combinations, and it's really important that patients and their caregivers really have discussions with their oncologists, their surgeons about what treatment is right for them. But in general, the side effects like rash and diarrhea and some of the other things that immunotherapy can cause are pretty manageable. And for those 3 cycles prior to surgery, most people tolerate the regimens well.
How does immunotherapy work?
So that's a good question. Unlike chemo, which works by directly killing rapidly growing cancer cells, immunotherapy works by stimulating the body's own immune system and kind of taking the brakes off our own like T cells so that the immune system can attack and track down these cancer cells. It's been a significant advance, not just in lung cancer, but in many, many disease states. It's a true significant development that's really enhancing patient care.
Dr. Bernicker, where can we get more information about everything you've discussed with us today?
So certainly patients and their caregivers can speak to their healthcare professional. But in addition to that, the American Cancer Society has got a very great, thorough website with a lot of information about lung cancer in general and other cancers. And they can certainly also go to opdivo.com where they can see a lot of information about immunotherapy.
Will do. Well, thank you so much, Dr. Eric Bernicker, for joining us today. Really appreciate your time and this important information about lung cancer.
My pleasure. Thanks.